And we're live. Hey people, welcome to episode 254 of the Sports Therapy Association podcast. My name is Matt Phillips, creator of RunChatLive.com, and as always, this episode is being recorded live on the Sports Therapy Association YouTube channel and Facebook page on a Tuesday night at 8 o'clock in the evening. Right then, so we're going to continue our countdown to the STA Southwest and Hands-On Hub Conference happening in Exmouth this September the 20th and 21st in collaboration with the ST School. If you can't make it, then you're not going, then please don't switch off. This isn't just about the conference whatsoever. We're just using the conference as a conduit for some magnificent information, and you'll still be able to gather loads from the last 3 episodes we've had with speakers and also just all the social media and stuff we're talking about. So, I don't want you all sitting there suffering from FOMO because you can't make it. But we have got the director of the ST School in tonight. So we're going to go into a little bit more detail about what the conference is and what some of the priorities and the goals are of it. Because it's only 10 days away now, about 12 days away now. So we're all getting very much ready for it. It's going to be an amazing weekend. It's a full day on Saturday, half day on a Sunday, full of presentations, workshops and networking. And like I say in this episode, we're going to talk to the director of the ST School herself, Maria Mazzieri, who's going to be discussing on this episode what we mean by evidence-informed practice, which is something that was raised when we did an episode on a panel episode with less experienced therapists talking about some horrible experience they've had in Facebook groups, suffering at the hands of people who probably well-intentionally were trying to point out that what they said on their website or what they were saying in their post was not evidence-informed. And a couple of them, if not all of them, kind of said, but we weren't taught what evidence-informed is. So having that shouted from the rooftops at us doesn't really kind of help. What are we supposed to do? Where are we supposed to go if people are just going to shout that in our faces? So we're going to have a look at that tonight. And fortunately, it's good timing because Maria is going to be giving 2 presentations at the conference, which are very much about that. The first one is when pain echoes trauma and when massage echoes embodiment. And then the second one is massage and manual therapy for scars. So we're going to talk in more detail about that later on. But firstly, I must thank extremely my guests from last week. If you missed that, then it's a fantastic episode. I know I say that all the time. It was such a good episode. But with Dr. 𝐂𝐧𝐬 𝐿, founder of Get Back to Sport, and Serena Simmons, who I haven't had the pleasure of sitting down and talking with before, founder of the Psychology School. In that episode, they discussed the importance and value of clinicians combining exercise education and psychological skills and practice, which is something so close to my heart and something that I'm going to be talking about at the conference as well with my presentation, Mindful Strides, how to communicate with runners. So it's something, obviously I'm biased. I love everything to do with communication, but it was such a great insight into how when we've got a human being in front of us, we need to consider everything. We've kind of learnt about biopsychosocial a while ago now, but how to put that into effect is something we didn't have quite as much as we do have now. A wonderful episode. Dr. 𝐂𝐧𝐬 𝐿 is going to be presenting at the conference on Saturday, the September the 20th at 10:30 a.m. in the main theatre with strength and conditioning for preserving joint health. Then Serena Simmons is at 12:15, Beyond the Treatment Couch, the hidden power of words, belief and behaviour. That's going to be absolutely amazing. I recommend that you make a beeline for that. And then at 1:40, I'm sorry whoever's in the breakout room at that point, or it might even be me, I don't know. But yeah, I do recommend you consider that anyway. And then at 1:40 p.m, Claire and Serena are going to join forces together in the breakout room to deliver why rehab needs a joint approach. Apologies in advance. If you look at the program at the ST School at 𝐂𝐳𝐿 UK, there's going to be clashes. You can't learn and experience everything there. We've got 2 rooms, a main theatre and a breakout room, with the idea of the breakout room being a little bit more practical in nature, although both are going to involve a lot of the time kind of practice. So there's going to be clashes, but you're just going to have to think, right, what can I do this time around? And then save the rest for next time. But yeah, so looking forward to that. And then next week, just to finish off this countdown, with great pleasure, my guest is going to be conference speaker James Earls, writer, lecturer and bodyworker and founder of Born to Move, whose presentation at the conference is entitled The Knee, Why Do We Have It All Back to Front, which again is a passion of mine of how anatomy we're taught in such a strange backward way sometimes when it comes to suddenly working with human beings and not with kind of 2D anatomically perfect kind of posters. And James in his unique style manages to turn complex ideas into something simple and we can take away and practice in clinics. So I recommend you join me next Tuesday if you can at 8 o'clock on the Sports Therapy Association YouTube channel or Facebook page. And that'll take us all the way up to the conference. like I say, on the 20th and 21st, which I should include. I mean, you'll see advertised there is a social event on the Saturday night. Before you get all excited, I'm afraid that tickets have sold out for that. Those of you who have signed up for the social event, which has got buffet and live music and all sorts of stuff going on, then you'll receive an email soon in the next few days with details of that. But if you can't make that, well, you can't now if you haven't booked for it, then make sure that you can still get tickets for the conference itself for the Saturday and the Sunday at the stschool.co.uk. So many other speakers which I haven't mentioned already, but just a shout out to Michelle Lyons, Siobhan O'Donovan, Chinty Sheeran and Lou Hawkins-Thompson of �Womenkind Collective, Andy Hosgood, Dr. Nora Nelson, Tristan Attenborough, Gary Benson, me, and so many others. And apologies if I didn't put in that list, but it just wouldn't have been good podcast listening. Right, that's it. Let's get back to tonight's show. I'm very excited to bring up the director of the ST School. A lot of people will know Maria Mazzieri through Therapy Expo, through other conferences, and through a lot of the webinars and courses and everything. So it's a great pleasure to bring her up. Anna Maria, and he said doctor then. We'll talk about that. It's not quite ready yet. But Anna Maria Mazzieri. Let's bring her up. Anna Maria Mazzieri. I nearly slipped up then. Oh, imagine the day I can say Dr. Anna Maria Mazzieri. Tell us about that first of all. How's that going?
Starting on the 1st of October, I literally, when I got the confirmation, I spent the whole day in bed the day after because I kind of had a little bit of a meltdown. And my son said, "But Mama, you applied for it." Yes, but I never thought it was.
You thought I'd get it?
Get it.
Oh, dear. I'm so excited for you. You didn't imagine that was going to happen, did you? But, I mean, it's a natural progression.
Honestly, no, I never... People like me don't do PhDs. We are not supposed to do PhD. We are not supposed to be academic. People like me been told, but actually you realize that once you are in an environment that nurture you and you feel comfortable in who you are, you will be surprised what the skills that you achieve and where you find yourself. And I think it's at the right time, and I think it's the right thing to do for my, for me, I'm doing it for me personally more than, for the profession or anything. I'm doing it for me, and I think it's fantastic. I'm really excited, actually.
I'm sure a lot of people are going to benefit from it, though, because you've already been involved in papers, haven't you, and worked with Roger Carey and co. And so, no, it's brilliant. We're all very happy to see you in it.
Thank you. Thank you.
Right then. So,
Can
it's
I
nice.
say
It's
something,
nice.
Mark?
Oh, go on then. Yeah, go on.
Yeah. Just when you said before about the conference, and you said, "Oh, you might have to choose people, to the main room or the breakout room." But actually, I must say that you and Andy created these 4 words tagline: pause, reflect, connect, and grow. Because actually, part of it, the pause and reflect, is you have to actually stop a moment, reflect on where your knowledge gap is, and then go and choose what topics you might want to listen to. And I do think that, that pausing and reflecting in itself, that is something that we are sometimes missing in our industry because we don't have the opportunity, or maybe because we are not, we don't have the right CPD that we value or it has been valued to do that. And this is, I link it very much to evidence-based practice, because what is evidence-based practice is not being critical and being evaluating of one's own practice, one's own values, and so on. So to me, that links very well. To me, the fact that people have to choose between going and listen to Claire Mitchell or going to listen to Nora, for me, that what they choose, that comes from a reflection and identifying a knowledge, and that is important. That is learning.
That's such a good point. That's really good. And you've made me feel guilty now, because I'm like, oh, you're just going to be running around. I mean, trying to find the next conference, trying to find the next speaker. But it's so interesting what you say. And it is that the tagline of the conference is to pause, which is a lovely first word to say. As soon as you walk in, just take a breath and to soak it all in, and don't make any decisions yet, and reflect and connect and grow. It's great. And you might not decide who you're going to see until you've actually witness one presentation or workshop, and then you have a look and go, actually, this could lead on quite nicely from that. So very cool. I like that idea.
When I was writing the latest email and about a little sentence for each of them, I got quite excited because actually let's use those 4 words as our driver for those 2 days and for the futures after those 2 days. It can be a mantra. Check
Very
that out,
cool.
Matt. A mantra. You created a mantra.
And it's so cool as well the way you've raised the fact that pausing, reflecting is evidence-informed learning. I mean, it's no surprise if you go into teaching, and that's what students have to do in order to process information. So why aren't we doing that at conferences? Why are we running around like headless chickens trying to go from one show to the other without chatting about it and reflecting? So
because we're not used to. This is the problem, even with evidence-based practice. Sorry if I'm deviating from what you wanted. This is the problem also with evidence-based practice. Why it is difficult to introduce evidence-based practice in our profession? Because by default, we are being made to think that our profession is only practical, is only doing hands-on. There is no that digging deep. I always say to my potential students, I said, the course in itself is not difficult. What is difficult is you're going to dig deep in your thinking process. And that, because every time a client comes into our clinic, we got to dig deep then. So we need to learn that. And I think sometimes that's why evidence-based practice don't come as easy for us, because sometimes we're not used to think at that more reflective and evaluating level.
Which I guess is what level 5 should be, using your brain more, as opposed to traditionally where level 5 is amazing new ways of using your hands and doing kind of tests. It's more about using your brain.
You use your hands in the same way, but the reasoning behind it, the justification of why you do it, it's a change in it shouldn't be a change in mindset. It should be a progression to a mindset that somebody already gave you a level 3 and 4. But that's what it is. People expect to learn these advanced techniques, as actually is the reasoning behind it that can make all the difference.
That's so cool. I really hope that, one of the reasons why we're doing this episode on what is evidence-informed practice for massage therapists is because we had that episode a while back, like I mentioned in the introduction, where kind of less experienced therapists were coming to Facebook groups looking for support, particularly people who work by themselves in clinic, thinking, I'll get some support from some people who've been in the game a bit longer. And there is, unfortunately, a trend now, and I think a lot of the time it is well-meaning, like we discussed, where people kind of say, no, you can't say that, you don't do that. Where did you learn? Did you pay money for that course? And a lot of the time it's not kind of trolling, it's just people don't realize what it's like, maybe have forgotten what it's like. But so it's wonderful to have you along. How does it make you feel because you've been involved in a few of those threads as well, and I think
on both sides.
On both sides, haven't you?
Sometimes I am on both sides, Matt, because sometimes, despite me, and people who knows me, they know how long it takes me to write a post, because I can be so blunt. And for people that don't know me, they think, oh my God, how patronizing it is. And the last thing I want to do, because I want to be supportive. So I've been on both sides. I've been the one. I do think that in the moment in which we are on Facebook, I say that as a context, we need to be prepared to have to cope with some personalities and with the fact that words in text loses the nuance. It's also true that you cannot be writing an essay to create a nuance. Said that. However, from the other side, you said it beautifully. People are joining the forums because they say, because our profession is very, if you're a one-man band, or even if it's not, it's quite isolating. So what a beautiful thing, having forums, people like you. So you go there and opening up your heart, and I'm okay with being critical or to receive, but then you have to offer also a counterbalance to say, okay, this is the way you're thinking it might be outdated because this is new way of thinking, or this is what the most accepted way of thinking. And I think sometimes that is missing. I think sometimes he has become much more attractive on both sides to actually go and pick those forums to pick for people that they might write a message that is not quite up to date. But actually, I know from, different forums that sometimes people might ask, you might have the most up-to-date therapist, but sometimes the way they ask a question might have been a little bit different. And we should not be there lurking to just, And ultimately, what are we doing it? Do we want to support our colleagues? Or do we want to knock them down? We can never change people's minds, but I'm hoping that when I write a message, if hopefully I use the right words, the person might not change their mind, but they might have something else to think, and more ideas come out of it. There is not the right or wrong, and I'm a little bit worried that we are losing that support. Why are we doing it? Do we want people to become better therapists, or do we want just to knock people down?
Yeah.
Said that, and I always have the extra. Be strong, learn how to debate, because that's I might sound very confident on social media, but we've been doing it such a long time. Just be able to justify, even if you're making a mistake, say, actually, sorry, I thought that's how it was. Thank you very much. Justify your position and learn to debate. Absolutely learn to debate. And that is, I think, would benefit everybody, will increase everybody's confidence.
Great point. And in all honesty, as well as having a bit more, well, I mean, it's so difficult, but yeah, courses from the very beginning should be talking about evidence-informed and that sort of stuff, shouldn't they? And they're not, which is for another conversation, traditional courses. But there should also be, I imagine, modules on how to survive on social media these days, and how to debate, and how to kind of, logical fallacies and all these things. It should be there from the beginning, shouldn't
it? To me, when we're talking about evidence-based practice, there is this great confusion out there, they think that evidence-based practice is practicing what the meta-analysis tells you. It's more complex than that. I would say to everybody to go and look at 𝐂𝐧𝐬, the original 𝐂𝐧𝐬 paper about evidence-based practice. It is a beautiful interplay between, you need to take into consideration, yes, the evidence, but in order for you, with your therapist expertise, not even experience, you don't have to be experienced, you have to have expertise in order to cater for the client's need. It's about having the clients there, listening to the clients, to the needs, to the values, to the social, psychosocial well-being. And then, for that particular case, what does the evidence telling us? And then our expertise is to match the two so that we can provide a treatment or an approach that is evidence-based, but also, don't go and look, is massage, is there evidence for massage benefiting, I don't know, in plantar fasciitis? No, let's look, how does plantar fasciopathy behaves? How do people with plantar fasciopathies, what do we know about plantar fasciopathies, treatment, and so on? Then let's have a look out of that. What are my skill set that I can provide? Because I argue with hands-on, because we know, even with things like tendinopathies, there have been quite good studies coming out that they find that the risk factors often are much more psychosocial than biomechanical. So being in a room with somebody that is in your team, in terms of that supporting you with a hands-on, that in itself is evidence-based. Obviously then, you have to provide the right exercise, you have to, if you do not do exercise, you have to signpost them to the right people and so on. But I argue that there is, there is evidence. It doesn't have to, you don't have to look for, is there evidence for massage, change in plantar fasciopathy or things like that, because that's not what we should be looking for. We should be looking at how do we help the person with plantar fasciopathy.
That's very cool. I like that. How do we help the person? And that goes for everything, doesn't it? How do we help the person with? How do we help the person with? It should be the person who comes first in the sentence. Very nice. Was this in your mind when you kind of decided to put this conference together? Is this to do things slightly differently and have the power in a way to address these things and help other people know about it?
Yeah, a couple of things. I mean, been toying, everybody knows that I've been toying with the idea of having a conference in Exmouth for a long time because of Southwest, we never get anything, and I'm just very proud of Exmouth. And I have the experience of other conferences, i.e. the Hands-on at Therapy Expo, which we've been very, very happy with. No. However, what we always found that was missing was the meaningfulness or making a conference meaningful, not only for content, making it meaningful for the particular therapists, for their values. Because how many times we go to conferences and we literally just go from one to another. We get bamboozled by good content and we go home, that is gone. And so the idea has been there for a while, and I know that, we talked, Matt, and so on, but then it all came because, again, Gary Benson is always in the middle of everything, Mr. Benson, absolutely in the middle of everything. One day he called and he said, "Oh, Anna, would you like to do the Southwest part of our conference?" Because he already planned to do different ones. And I said, "You know what? That was a sign from Lincoln. It was a sign that, I already wanted to do that." So, and I collaborate very, very well with Gary, and we get on very well in terms of ethos. And we align quite well because we both, all our teams have the same drive. So that's what we want to, but something really meaningful for the therapists. So everything that is delivered there is literally things that you can use in clinical practice, because we find both within training or conferences, does it really help the people that they're catering to? Or is it just somebody wanting to showcase their own skill set at the conference? Or is it, what do our audience, our massage therapists, our soft tissue therapists, those other manual therapists that use hands-on a little bit more, what might they benefit from, and how would they look like in the practice?
Very cool. Yeah, and that's exactly what we've lined up at this conference, so very exciting. We're putting the experience, aren't we, back into learning. We're putting the play back into it. All these things we talk about, it's so weird, isn't it? We talk about all these things, the importance of play, to learn, of experience, of reflection, and then bam comes a conference for learning, and we go along, we sit down there and the stage there, and we just listen and maybe write some notes down. We go to the next one, and then we go home. And it's funny
and
how
this one is different, because it's going to be, sorry, Matt, I stop you. Quite excited. And you've been a bit driver of that. So, let's give you the credit. You've been a bit driver of that. So even the environment, we're not going to have theater, how do you call it, theater style? Mm-hmm. We're going to have tables. Yeah, because then people have to network, or people have to feel they're part of something and go together with something somewhere. And we know, people sometimes says to me, "Oh, Anna, how do you get yourself onto those, things I got my hands?" Because I network and I ask and I challenge and I ask questions. And then you see them again somewhere else, and you build then a group of people. So, I was talking, I have to prepare something, I can email plenty of people in the industry, say, "Oh, how can I do that? Or how would you do that?" People are there to support, you see, but you have to, network. And I don't know what you think of it, Ma, because I know that you like online and I like it as well, but I have seen this just lack of easiness in being in person again. How many of us feels now overwhelmed to be in an environment like that? We need, and again, I said it into one of the latest emails I sent out, us, that we will never jeopardize or compromise on in-person courses. We still do the online. In fact, now we do a lot of hybrid because it works. But in person just gives you, there's something as a practitioner. There is a reason we became practitioners. Let's not make that need for human connection die down.
Definitely. Strong words. It's probably, that's a good segue. It's probably worth mentioning that for those people who have joined us and are listening and they want to learn about what is evidence-based practice in massage therapy and what social media doesn't tell you, then guess what? There's a course, there's a webinar on the ST School website, which is called, I quote, Evidence-Based Practice in Massage Therapy, What Social Media Doesn't Tell You. And that's been around for a long time, isn't it? It must be frustrating when you see so many, I know I get frustrated, you see so many therapists struggling with what is evidence-based practice, and then you've had a webinar for I don't know how many years telling people what evidence-based practice is and evolving with it, but it's just so difficult to reach people, isn't it? It's a problem we've got now. Great information, but how do you reach people? But how's that course going? What do you find are some of the takeaways and some of the surprises that people have when they join it?
I love the course, and all of our webinars, we have quite a lot of enrollments. One of the things that I would love to see more, it's joining live. Many people likes to listen to it, which I appreciate, but it takes away sometimes the interaction that can happen. So from that perspective, I prefer people coming more, on screen. That's why we don't just put them up and sell them. We could just put them up and just sell them like that. I just don't want that. I want the interaction. Because when they come in with questions, Matt, and this is the beautiful things, and it happened with pain as well, I am seeing that difference. I am seeing that now when I start asking people about evidence-based practice, they might not have the right words, but they're starting understanding more and more about the need for it and not pushing back as much. What I find that absolutely consistently, people come out with and they say, oh my God, I didn't realize that actually it is about the 3 dimensions. And the way I teach, I teach it very much because there are many different interpretations there have been, but I very much follow one particular kind of, call it the school of thoughts and so on, that keeps on to the 𝐸𝐸𝐾𝐻, original 𝐸𝐸𝐾𝐻 and 𝐸𝐸𝐻 definitions, where you have this interplay between evidence, client's need, and therapist or patient's needs and values and therapist experience. Because Eric Meira, a few years ago, he made I think it was his ones actually, he made a funnel, and he put at the funnel, everything needs to be funneled through the evidence. And to me, I do not like that, because it gives the evidence there is a hierarchy between evidence and client preferences or expertise, especially, and this is going to sound such a nepotism, so forgive me for that, but my son is going to deliver a session, and I kid you not, even if he wasn't my son, I would have had him to deliver this session, okay? Because what anthropology, looking at evidence-based from an efficacy, from an anthropological perspective, all of a sudden we're starting realizing that there is what he calls a medical pluralism. There are different approaches to healthcare, different perspective to it. So we have to be very, very careful when we talk about evidence-based practice, and we define it and we understand it as it should be understood, and not making it as reductionist But it's important that when we practice it well, that we are not going to scour a mice study to support an argument. Because that's not what evidence, that's not what research is, that's not what science is. So that for me is quite important.
definitely. It is. Cecily has actually summed it up nicely. Cecily Hislop says in the comments, thanks Cecily for the comment, joining webinars live totally takes me out of my comfort zone, but it's so much better an experience, and I usually get to make a total prat out of myself. I can't believe that, Cecily, by talking far too much. But I think the key words in there are take you out of your comfort zone. I mean, we learn a lot when we're taken out of our comfort zone. You know, it's like I had the pleasure of spending time. You might know a little village called Numana in Italy, a very beautiful place. And I didn't go over there learning Italian. I knew a few words. But when you're actually going into a bar or you've got kids running around and you need to get something done, and suddenly you're speaking it because you're outside your comfort zone and the communication happens and you learn it and your brain registers it. And even that, even on holiday, made me think, wow, it's so true. We just sitting there and watching a stage and the words go flowing into one ear and out the other. You don't learn anything. You need to be tested. You need to be put on the spot a little bit. Cause to reflect, maybe a little bit of pressure, but not too much, just enough to actually question yourself and go to a place you wouldn't normally go to.
In predictive processing, Matt, that's how we explain learning. In predictive processing, if you always match the prediction, your body and your brain is nice. But actually, when the prediction is not matched and there is a prediction error, my dear, the prediction error, that is where the new learning takes place. So again, talking about there is a lovely sentence on top of the CPD booklet for the conference where Feynman, where he says that we can only learn when we see a gap in our knowledge. A gap in our knowledge can only happen if we are questioning from a question, something like that. And that's true, until we are uncomfortable with something, we won't learn.
It's a great point. So basically, if you come to the conference, get ready to feel uncomfortable. Very uncomfortable. We've got horrible chairs for you.
Dig deep.
Dig deep. No, it's but that's part of a job of an educator, isn't it? A modern educator, of knowing how to. I mean, there's parallels there when you're talking to a client, especially if your client or patient, is going to have to make some behavior or lifestyle changes. In order for that to happen and to find their motivation, they might not want to do it straight away. You've got to cleverly, through active listening and that, challenge them a little bit, give the right reflections to make them dig a little bit deeper, to peel off a layer. So we do it with our clients. We should be doing it with our clients. So we should be doing it to ourselves as well if we want to learn and get better at it. So great point, Cecily. I bet you didn't realise you were going to generate so much interesting talk from that. It's great to be taken out of your comfort zone. Not all the time, but a lot of the time. So thanks for that, Cecily. Right. Talking of, look at the time already. We could talk about this for ages, but no surprise, when we get together and talk, it could go on forever, which I love. Let's look at, in a bit of detail, the presentations that you are going to give, because again, I think there are areas where there can be some debate of, is it evidence informed and is it evidence based and that sort of stuff. So let's have a little look at them. I'm going to bring them up here now. So the first one that you're delivering at the conference is going to be on the Saturday, September the 20th, in the main theatre at 3:10, if people are writing these things down. It's on the screen. If you listen to the podcast, then we do obviously do it live. It's on YouTube, and you've got like all sorts of visuals if you're that sort of person. So go along to YouTube to have a look. But the first talk is, when it's called When Pain Echoes Trauma and When Massage Echoes Embodiment. How could you turn that into Mickey Mouse language so that mere mortals like me could understand what it's going to be about?
This one comes from the last 3 years has happened to be 3 years work with Laura Case et al. From Neuromatters in America, that we have created this massive piece of work, a review of the evidence around it's part of a project of mechanistic research for massage and manual therapy, and what we looked at the evidence for a more somatic or body-wise effects of trauma. And so after those long time like doing this paper, which should be hopefully coming out soon if there are no need to do any more revisions on it, is, the things that I discovered were quite shocking and I didn't know. So I didn't know, for example, that chronic pain. So when pain equals trauma, actually people with trauma are nearly 3 times more likely to suffer with chronic pain in the future. Not only with chronic pain, but also with other diseases like metabolic diseases, like type 2 diabetes, or even with obesity and so on. So from that perspective, we're going to be looking at this the link. So what is evidence telling us about the link? Is there evidence, and how good is the evidence? How can we rely on that? And because actually the evidence is a bit different what we have here that in normal stress. So there are some markers there that makes it a little bit different working with people with history of trauma. And this is where this is a proposition, and this is the future work that I'm on, is we know that pain, then trauma affects the coherent sense of self. What we call it, you probably hear it as embodiment. So the awareness that you belong within your body, that your body is yours, that you feel connected within you. And so we know that trauma disrupts that, but we also know that somatosensory integration helps bringing you back. I gave an example actually this weekend to my students. If I touch you, if you get touched by somebody else's, how do you know that you get touched? It confirms that you get in touch. It confirms that you are you, because you feel the touch, but you also feel that the hand touching you is not yours. So it is evidence, because if you have a good sense of embodiment, it is evidence that you are within your body and the person touching you is different. How many times you had a client coming to you and they say, oh, I feel my arms is not mine. Obviously, you would have been a good clinician and checked any neurological or neuropathy. But sometimes with chronic pain, they say, oh, I just feel that, the arm doesn't belong to me, or the leg doesn't belong to me. That happens in chronic pain. And that is the disruption between what they feel from outside with what they feel from their interoceptive signaling. That mismatch, the inability to give the right meaning to those sensations, create this sense of a lack of coherence, what I would call a lack of coherent self. So we know that can be improved through somatosensory integration. So to bringing in so many more senses during our work, and that's in a nutshell. You don't have to come and listen to my talk. That's
No, because I get it now. I mean, so basically, and this will be like music to the ears of a lot of people whose profession is making people feel good. There's now more research to show what's actually happening with whether you're using cupping or dry needling or massage or anything.
That's exactly.
We're beginning to actually now potentially have mechanisms of action. And, it's the old cliche, but so true. If we know how something works, we can make it work better. So that's where this research is potentially taking us, which is so exciting.
If we know how something works, so not only we can make it work better, we can change our approach. And then because of that, our client would change their approach to their own pain and injury and so on. So one of the things that I'm going to be talking on that is that we need to be very, very careful about what they call trauma-informed practice. And, I see a lot of courses out there, trauma-informed massage, or courses that teaches you certain type of techniques because, some part of the body releases some trauma. There is a lot, I will be discussing that. Okay. Because we need to be very, very, very careful. We're dealing with
sounds
vulnerable.
Great. Yeah. No, sounds obviously especially useful if your clients do involve people who have been through those sort of experiences, but also if not, because you're just getting into the nitty gritty of what's happening when you're touching somebody and the kind of research.
Matt, you wouldn't believe how many
So
people
exciting.
I didn't realize that actually for a child, financial instability in the household, that is trauma. A child, no, certain things that we would not even think that might be trauma, they actually can be traumatic, and we don't even know. So it's not to us to diagnose or to even say that's trauma. Certainly no, but for us to be absolutely aware of it.
Wow. Okay. Right. We could do a whole episode of that. My brain's just started now firing, and I've got loads of things to ask you. But no, not now.
No, yes,
Because that's what the content of that's going to be, and that's a great example of how people are going to walk away with that and need time to reflect and kind of consider, probably look inwards as well. Because there's going to be loads of people who have suffered things like that themselves, and that's always healthy, isn't it? Not for therapists to look inwards and look at themselves, and then that helps you help someone else. Because if you don't understand yourself and you don't give time to yourself, then how are you going to help others? So anyway, I'm going to sweep that forward and move on to the next one, which is still a wonderful look at the evidence behind certain things we do. The next one with Anna Maria at the conference is going to be on the Sunday in a breakout room, and that's 9
o'clock. Do you reckon we're going to be there at 9 o'clock?
Well, I'm not going to say the conversation we had, but yeah, that's when it is. And that's called Massage and Manual Therapy for Scars, an evidence-based approach. I'm really interested in this because I was one of the people from probably 10 years ago who were, very much including in all sorts of presentations about, muscle massage and manual therapy doesn't break down scars. Surgeons use a scalpel for scar tissue. So this is often kind of used in the old argument of you've got to be more evidence informed. So I'm always very excited when I come across people who are talking about massage and manual therapy for scars, especially when they follow it with an evidence-based approach. So give us a little look into what this is going to involve.
Yeah, you just actually said it. First of all, working with scars does not mean that we break down scars or that we want to break down scars. What it means, we know the scars can have a effect they become hyper if they don't heal well. So if a wound doesn't heal well, scars can become hypertrophic, they become hypersensitized, and actually they become restrictive in movement, especially where they are and after certain type of surgeries. So but we can intervene and help the person with the scar. So we know that how the body, we know about wound healing, or we think we know about wound healing. There are certain things we cannot interrupt it, but we can definitely make it worse. The way we add load, when we add load, can we affect it with our hands? We cannot, but we can affect how something feels, so that then the movement that somebody then gets because they feel better, that will help. And also I'm going to be using cupping, I'm going to be using silicone sheathing, talking about different strategies to work with scars. I'm going to be focusing a little bit more for what we see much more often, which is joint replacement scars, especially knees, hips, and mastectomies. And we're going to have bodies coming in. So unfortunately, the people with those, the scars that are coming in, the scars are quite old, but it does not make a difference, because what you're doing, it's about changing the way the person, we'll see it, but it's about supporting the person where the scar is healing, but certainly not breaking down scars. But we know one of the things I'm going to be talking about as well, I'm going to be talking about what we know, some really nice research around fascia, because there are some really nice research coming out from the fascia world. Does that mean that research will, do I make my clinical reasoning out of that research? No, because it's not clinically relevant. But is that knowing about that research is important for me, because what is now preliminary, it might form the basis in the future. So it's important, even if I know, to know about, the research in mice, for example, because although I cannot make a clinical reasoning out of that research, because it's not valid for clinical reasoning, but it's still important for us to know what's happening.
Excellent. Very interesting. And we're going to, I mean, it's seems a coincidence, but we're going to do a fascia special on the podcasts sometime after the conference to talk about how the research is changing. Because again, my passion now is looking at how we are getting explanations for things which are have been traditionally poo-pooed. We've been through that era of denying everything and saying that's rubbish. And now it's so interesting that this presentation you're talking about is now giving a different perspective for cupping, so this is so empowering for therapists, because you can do what you do, and I'm saying you have to stop. That's not what evidence-informed practice is. It's just having a little think about what's happening and why you're doing it and what's happening to the individual with you and that sort of stuff. And this is going to be a good example of that. Very exciting, really good. And as it's in the breakout room, then that's obviously going to be more practical in nature. Is the idea of the breakout room that people watching will be able to get involved with some of the...
Yes. Mm-hmm. So we're going to have couches. Some sessions are practical. They're going to be couches. You can be hands-on, or some of them, there is some yoga, breathing yoga. So much more, I think, using rehab equipment, and the same for 𝐂𝐧𝐬𝐴 core. But that breakout room is those sessions where they're going to be mainly practical aspects, where people actually get involved, interactive. That's the right word.
Wonderful. Very exciting. Right, where are we? 10 minutes.
God, that looks like a Reservoir Dogs.
It does, doesn't it? It's a great photo.
I love that.
It's a great photo. So I wanted to check. Oh, there's something. So the Saturday and the Sunday, all day Saturday, half day Sunday, which I think is a great touch, because it means people can actually get home. It's taking the stress out of things as well, which is nice, isn't it?
Correct.
And also, I believe there's something happening on the Friday night, especially for people who are local.
Yes, and for everybody who want to attend, if there is a space, but especially for the local people. And first of all, we managed to put the diaries together, and we have several kind of jam sessions, free. They're free afternoon between 3 and 5:36, where people can join a massage for lower legs. One session is massage for lower legs. Another session is getting up, how to help clients, how to teach clients how to get up from the couch. It's all led by tutors or led by very, very experienced therapists. There are going to be some other massage sessions. We're going to release it this week. But what I'm very, very pleased about, that we managed to pull it together, is that because the times now fit, James Earls will be running. He runs usually in London what is called the Anatomy Cafe, and we're going to be running the Aperitivo Cafe. So it's going to be open to 20 people, and it's a little bit of a ticketed event, but it's quite it's very economical, because we're going to go to a local Italian store there, where they're going to give us a glass of wine with a lot of affettato, like Parma ham and all things, while James discusses something about anatomy.
Beautiful.
We did it once. It was me. I don't know, Sarah is not here, but it was me, Sarah, and James, and we were at the clinic, and James was talking. We were talking about the foot. So he took the foot model. We went to the Italian store full of people, and having a coffee, and us three there talking about the foot, and James explaining to us the anatomy, and it was really good. And so we thought, let's do it there. So it's going to be between 6:30, like an hour, and then we all go and sleep. But
sounds amazing.
It's fantastic, because the way James is just such a elegant speaker, but he's very original in his thinking of anatomy. Because he's a therapist, he thinks anatomy like we think it.
Definitely. Hashtag be more like James. Definitely. And it is. And by no coincidence, we will be speaking to James Earls himself next week on the show. So we'll talk a little bit about that as well.
Be more like James.
Yeah,
I
be
love
more like
that. I'm
James.
gonna tell him that.
Great. Right. We are running out of time. So just to remind people, tickets are still available for this conference if you want to go along, but it is happening in 12 days' time. But if you are, especially if you are local, because that's the idea, we're going to be doing more of these around the country. This is the little baby which is kind of starting it all off and putting this new way of kind of experiencing and pausing, reflecting, connecting and growing. That kind of educational conference. We're trying to put that together. But if you are around the Exmouth region in Devon or can get there, then go to the sdschool.co.uk and you can check tickets on there and join us. But if you can't, then don't worry. There'll be more and we'll be coming to you soon on the Hands on Hub Roadshow on a lorry. Fantastic.
I love that. And Hands on Hub and STA Roadshow. I love that.
That'd be great. We can do that. Just need to get Noel Edmonds out of retirement.
Annabelle is in Exmouth. Annabelle Sorovit is in Exmouth. Exmouth, Devon.
Oh, fantastic. Yeah. Is that a comment in there? So I didn't see that.
Yeah, it is, yeah.
Let's just bring that down. Thank you everyone who's joined us live. Apologies if I didn't get to some of your comments. Brian Huxley is here and saying hello. You're late, Brian. Just send the reason as normal on an email to matt@thesta.co.uk, just with a doctor's note, whatever it is.
Rude.
And then Annabelle as well. So Annabelle Sorovito, good to see you here. Where is the conference? Yes, at Exmouth, Devon. On the beautiful Jurassic Coast, just south of Exeter. Lovely place.
Hometown. That beautiful. Would sound better. My hometown.
Anna Maria's hometown. Not where she was baptised, because I've seen the church and touched the door and kissed the ground of where Anna Maria was baptised in Italy, in a place near Numana. I took a picture there. But that's another story for another show. Right. Thank you, everybody who's listened to the show. I hope this hasn't been boring if you know you can't make it. I mean, there's so much we talked about today, which hopefully is relevant to listeners. So, if you can't make it, then hopefully we've still given you some information to ponder on and reflect on. If you do want to join a live recording and ask questions to the guests, then as you can see on the banner below, and all you got to do is come to the Sports Therapy YouTube channel or Facebook if you prefer, on a Tuesday at 8 o'clock. And like I say, we'll be here next Tuesday at 8 o'clock with James Earls of Born to Move. And if you do enjoy the show, then do please subscribe to our YouTube channel. And even if you don't like YouTube much, it just really helps with the algorithms and for the good information from people like Maria Mazzieri to just appear more and for people to find out about her evidence-informed for massage therapists rather than feeling alone and not knowing where to go for the information. So subscribe to the YouTube channel and leave a rating or review on the podcast app, particularly Apple Podcasts. That would be wonderful. But for now, I think that's all my housekeeping done. I just want to say thank you once again to Maria Mazzieri. Thank you for joining us.
Thank you.
So interesting. I mean, I knew what you were talking about, and now I'm just so excited about those two presentations. I'm not lying either. So
you know what? It would be very interesting if people that they're coming, or even people that they're not coming, but maybe they send emails on what question they would like to ask about, so that somebody can actually ask those questions to the speakers on the day.
Here
you
we
know
are.
What I mean? Because there might be people that might not be able to come, but let's, talk especially the STA members. So that, ask some of the questions that you might have been always interested, and so we'll collate them. I will get some of the team to collate them, and then we can ask those questions for you. Because that will also, that in itself, and then you can write it down. There is another CPD activity.
We'll do that. That's a great idea.
That was quite a good idea. Yes,
we've got time. Yeah, it's good to introduce new ideas 11 days before the conference starts. Great.
Welcome to me, Matt. You know that, yeah.
I know, just the personal sort of you. Right. That's it, everyone. Thank you so much for joining us. And if you are free next Tuesday to join us live in person on screen, then that'd be lovely as well. If you can't, you're working, then no pressure. But if you can rearrange a few things, that'd be lovely to kind of join you and hear your experiences and thoughts and ask questions to James in direct. Until then, take care of yourselves and take care of each other. We'll see you soon.
Ciao.
Bye-bye.
Ciao a tutti.